Welcome to the National Law Enforcement and First Responder Wellness Center at Harbor of Grace, better known as HOG. Harbor of Grace Enhanced Recovery Center, HOG, understands that each patient is unique and requires a comprehensive approach to treatment. From detoxification to aftercare, HOG provides a continuum of care that includes evidence-based therapies such as EMDR, brain spotting, cognitive behavioral therapy, group therapy, 12-step, holistic approaches, and physical exercise. Our program is designed to address each patient's physical, emotional, and spiritual needs. Recovery is a journey that requires commitment and dedication to principles. The fundamental principles of this journey, we believe, are honesty, open-mindedness, and willingness. Honesty is the foundation as it helps us to acknowledge our behavior tendencies and accept that we need help. Open-mindedness helps us to be receptive to new ideas and perspectives. With an open mind, we explore the different perspectives and approaches to recovery. Willingness helps us to stay motivated and focused on action. Without willingness, we may find ourselves stuck in the same old, comfortable yet destructive patterns. Discipline, respect, and cooperation are principles we exercise when residing within a community. These qualities help us to work collaboratively towards a common goal and create a positive and supportive environment. Discipline means following a set of guidelines or principles that will help us to achieve our goals. This requires us to be accountable for our actions and to stay focused on what we want to achieve. Respect means treating others with dignity and recognizing their worth and value as individuals. listening to perspectives and opinions and considering their feelings and needs in our interactions. Cooperation involves working together towards a shared goal, recognizing that we are all part of the same team and that our success depends on our ability to work together effectively. These principles are learned through application and persistent practice. At HOG, we help guide and direct our community members in the practice of these principles. HOG's goal is to empower patients to act on the principles and ideas they learn, build a foundation for long-term recovery, and improve the quality of their life. The disease gives alcoholics the magnificent news that they are sick rather than evil. That is, while their behavior is immoral, their disease is not. This realization is the key to recovery, for I further believe sick people want to get well, and alcoholics are sick people. Father Joseph Martin. Length of stay. Treatment at HOG is based on a 28-day program. However, it is imperative to note that HOG's program provides a personalized approach that caters to variable lengths of stay. HOG's clinical staff works collaboratively with patients to determine their individualized treatment requirements, relapse patterns, and necessary resources to support long-term recovery. Sample schedule. A daily schedule will be posted around campus and the CA building. 7 days a week, a staff member will wake patients at 6:30 a.m. Patients should be awake by 6:30 a.m. and ready to leave at 7:30 a.m. Transportation will leave for campus between 7:30 a.m. and 7:45 a.m. Patients are to be in their assigned room at 10:30 p.m. every night. Patients shall always remain in their suites between 10:30 p.m. and 6:30 a.m. Leaving the suite between these times will activate an alarm. In the event of an emergency in the suite between the hours of 6:30 a.m. and 10:30 p.m., notify the on-site CA. In the event of an emergency between the hours of 10:30 p.m. and 6:30 a.m., patients will open the door to their suite, which will activate the alarm. Meals. Breakfast, lunch. Every Tuesday, HOG staff will distribute a grocery list to patients. Patients select from this list food items which they will use to prepare their breakfast and lunch. The cost for these grocery items is built into the program fees. Patients shall prepare their breakfast and lunch from items in the community kitchen and/or items they selected from the grocery list. Dinner will be provided nightly by HOG in the residences. Twice a week, patients will select their dinners from a menu from Jimmy's Famous Seafood. Patients will have these dinners every night except for Saturday, when HOG will purchase pizza for all patients. Special dietary concerns, food allergies, etc. should be brought to the attention of the nursing staff so that accommodation can be made. Transportation. All patient transport shall be conducted in HOG vehicles, or as approved by HOG clinical staff. Patients shall always wear seatbelts when being transported by HOG staff. No eating or drinking in a HOG transport vehicle. 12-step support groups. HOG incorporates 12-step recovery into its treatment program. Patients are expected to attend all 12-step meetings that are offered in the daily schedule, unless otherwise specified by their therapist. 12-step is a tried and tested method that has helped countless individuals overcome addiction and lead fulfilling lives. Attending all 12-step meetings is a key part of the program, as it allows patients to connect with others who are going through similar experiences. While attendance at meetings is a requirement, patients are not required to share personal information or speak if they are not comfortable doing so. Ultimately, the goal of the HOG program is to help patients achieve long-term recovery. Alfie, the therapy dog. Alfie, the black lab, is our therapy dog that likes to interact with our patients. You can interact with him, play with him, pet him. He enjoys a good walk. Do not feed him any food or treats. Drop-offs and mail. 3 ways to receive items while in treatment. 1. Drop-off. Drop-offs accepted 24/7 at the main entrance. 2. Mail. Someone can mail a package with approved items to HOG on patient's behalf. 3. Talk to your therapist and order online via cell phone internet at retailers such as Amazon, Walmart, or Target, and ship directly to HOG. Hog staff will not buy or bring you anything from off-campus. All patient mail should be addressed as follows. Patient's name, first name, last initial. Care of Harbor of Grace, 437 Girard Street. Rules and Regulations. During patients' treatment stay, it is important that they understand that adherence to these rules contributes to the harmony of our community. Patients are expected to abide by all rules of conduct and fully participate in all aspects of the HOG program and the individualized recovery program established with clinical staff, including continuing care recommendations. Phone use. During treatment, HOG strictly prohibits patients from retaining personal electronics such as cell phones, laptops, tablets, pagers, computers, electronic games, MP3 players, and so on. Prior authorization and arrangement by a HOG therapist are necessary for personal electronics use. All patients are permitted to use the phone on Saturdays from 9 a.m. to 9:30 a.m. If you need to use the phone computer outside of this time frame, you must arrange phone approval with your therapist. Patients who are admitted on a Friday are under a phone blackout until the following Monday when they speak with their therapist. Clinical aides, CAs, are not permitted to allow patients to use the phone without therapist's authorization. Video monitoring. For the safety of our patients, HOG has a video monitoring system that covers the entire campus, residences, and property. There are 3 areas which are not monitored: the bathrooms, the counselor offices, and inside of the residents' apartments. Please be advised that while staying in detox, the inside of these rooms is monitored for the safety of our patients. Changing of clothes should be done in the privacy of the bathroom where there are no cameras. Search and confiscation. Upon admission, each patient will execute an authorization permitting HOG staff to conduct a full-body search and to search all luggage and personal belongings. HOG reserves the right to confiscate any contraband or items deemed inappropriate or incompatible with HOG's therapeutic environment. Confiscated items will be held in a secure place and returned to the patient upon discharge, subject to applicable laws and regulations. Prohibited items. Certain items are prohibited on HOG premises. These items are considered contraband and include, but are not limited to, the following: dangerous items, weapons, guns, ammunition, knives, rope, scissors, any other weapons, sharp objects, straight razors or razors with removable heads, metal nail files, multi-tools, i.e. Leatherman, Gerber, etc., bottle or can openers, tasers, harsh chemicals, flammable liquids, clothing, no revealing, provocative, or seductive clothing, promotion of violence, gangs, alcohol, drugs, or politics, offensive slogans or graphics and jewelry. Random testing. Patients must abstain from the use of alcohol, chemicals, and medications not prescribed or approved by HOG medical staff. HOG staff reserves the right to conduct urinalysis or breathalyzer testing at any time, whether random or for cause. Drug seeking is not tolerated. HOG staff reserves the right to examine and open any package, box, or envelope sent to HOG premises, and to read any correspondence addressed to HOG patients. Harbor of Grace also reserves the right to inspect any outgoing mail or packages sent by a patient. Incoming mail. HOG staff reserves the right to examine and open any package, box, or envelope sent to HOG premises, and to read any correspondence addressed to HOG patients. Harbor of Grace also reserves the right to inspect any outgoing mail or packages sent by a patient. Staff access to units. HOG staff reserve the right to access any residence suite at any time without permission or advance notification. All patients are solely responsible for their personal belongings. Hog staff shall not be responsible for loss of or damage to a patient's personal property. Patients may be held personally liable for damaging hog property or the property of another patient. Housekeeping. We are especially proud of the accommodations at Hog and aspire to be good neighbors. Patients are expected to keep their suites clean. This includes, but is not limited to, making the bed daily, keeping the bedroom, bathroom, living room, dining area, kitchen, common areas, and space around the residence clean and orderly, eating in the kitchen and dining areas only, cleaning dishes promptly and not leaving dirty dishes in the sink, disposing of trash in proper receptacles, and not altering, that is, nails, hooks, or painting, etc. Walls in the residences without permission. Only taking food from the residence in which you are staying. Drinking only clear liquids in the Hog-issued water bottle. Not putting hot water into the Hog-issued water bottle. Not eating or drinking in the group room, except from Hog-issued water bottle. Please do not take or eat food from the detox kitchen unless you are staying in detox. Personal hygiene. Hygiene refers to anything involved with self-care. In the context of recovery, it is not limited to the traditional definition of bathing and personal cleanliness. Patients are expected to learn and practice different types of physical, mental, and spiritual self-care. Physical self-care includes bathing or showering regularly, using deodorant, getting restful sleep, regular exercise, and seeing a doctor and dentist regularly. Mental self-care includes things such as seeing a mental health care provider and/or proper usage of prescribed medications to manage unhealthy behaviors. Spiritual self-care includes things such as active participation in recovery fellowship or regular prayer and meditation. Language and behavior. Patients are expected to refrain from the use of profanity. Racist, sexist, homophobic, and other abusive language is strictly prohibited. Patients shall always be respectful of others. Patients shall also refrain from excessive non-therapeutic talk of drinking and drugging, that is, war stories or drunkalogs. Hog reserves the right to prohibit any language it deems to be offensive or disruptive to the therapeutic environment. Dress code. Patients are expected to dress as successful people in recovery. Patients shall not wear crop tops, wife beaters, short shorts, or any politically motivated clothing. Hog reserves the right to prohibit any clothing that Hog deems to be offensive or disruptive to the therapeutic environment. Patients may not sleep in the nude and are to be fully clothed while in living and common areas of the residences. Name badges. Patients must always wear their name badge while on Hog campus. Noise volume. All noise shall be within an acceptable range out of respect for the community and other patients. Patients shall comply with any reasonable request made by Hog staff or other community members to reduce noise. Fighting/violence/threats. Fighting, violence, and threats of any kind are strictly prohibited and will not be tolerated. Patients should bring any issues with other patients to the attention of Hog staff. Money lending. Borrowing and/or lending money between patients while in Hog is prohibited. Gambling is prohibited. This includes, but is not limited to, dice games, cards, and games of chance. If patients are having problems resisting the urge to gamble, Hog encourages them to talk with their counselors about resources available to help them. Smoking and vaping. Hog encourages all patients to attempt to get and stay nicotine-free, and Hog reserves the right to prohibit tobacco use at any time for any reason. Patients who choose to smoke or use other tobacco products shall comply with the following rules. No smoking or other tobacco use inside any Hog building, including residential suites. Any violation of this policy will result in a $200 fee. All smoking and other tobacco use, including chewing tobacco, shall take place in designated gender-specific areas. All cigarette butts shall be disposed of properly in designated receptacles. Tobacco use is prohibited during any evacuation drills or actual emergency evacuations until HOG staff determines that it is safe to do so. Smoking is prohibited between 10:30 p.m. and 6:30 a.m. Patients shall keep designated smoking areas clean and free of butts. Patients wishing to quit tobacco products should express that desire to their therapist and nursing staff. Harbor of Grace will support efforts to quit by providing appropriate nicotine replacement therapies, NRTs. Vaping is strictly prohibited on HOG premises. Gender separation policy. Harbor of Grace enforces a gender separation policy. Outside of supervised therapeutic activities, men and women are not to commingle or pair off. Pairing off means spending any significant time together, whether in conversation, sitting, walking, eating, or smoking. Dating and romantic or sexual relationships. Patients are to refrain from romantic sexual relationships with other patients while in the HOG program. This includes sexual relations, pairing off, phone contact, letters, texting, and social media communications. Patient response to emergencies. In the event of an emergency, patients must follow the patient and visitor's response to emergencies procedures posted in all treatment and clinical service areas. Patients shall respond as directed by staff in emergency situations and emergency drills. In the event of an evacuation, patients must report to HOG staff at the designated evacuation site that they have safely evacuated the building. Evacuation procedures are posted in all residential and clinical service areas. Therapeutic discharge. HOG staff take patient recovery seriously and expect patients to demonstrate consistent improvement. Failure to abide by the community rules is a therapeutic issue, and incidents of such failures will be reviewed by the appropriate clinical team in the form of a behavior intervention. A clinician or case manager will work with patients during this behavior intervention to develop a plan to assist them to follow and respect the rules of the community. If patients continue to violate the community rules after the behavior intervention, HOG reserves the right to refer patients to the clinically indicated appropriate level of care. Readmission. Readmission of patients therapeutically discharged from treatment will be decided on a case-by-case basis. HOG admission staff will consider the length of time a patient has been in treatment, how long a patient has been out of HOG's care, the patient's behavioral issues, and their commitment to recovery and to abiding by all rules and regulations of HOG. Medical concerns. Medication. All medication, prescription, or over-the-counter shall be managed by HOG medical staff. Patients bringing prescribed medications to treatment must bring them in their original prescription bottle clearly marked with the prescribing physician's name, pharmacy information, date of prescription, and dosage. Patients shall turn in all medication, prescription, or over-the-counter to HOG staff upon admission. In the event patients require refills of prescription medication or new prescription medication HOG staff physicians will write the required prescriptions, and HOG staff will pick them up from the pharmacy. There are 3 designated times for scheduled daily medications. MedPass. Morning MedPass is when patients arrive on campus first thing in the morning, or 8 a.m. Afternoon MedPass is at 2:30 p.m. Evening MedPass is at 8:30 p.m. For unscheduled or PRN medications, patients may report to nursing at any time between groups. Communicable disease policy. Patient health and safety is the priority at HOG. Patients shall report to HOG staff any illness or symptoms of illness, which may require treatment or expose others to a health risk. This includes reporting to HOG staff the following: fever or non-exertion-related sweating, wounds or skin conditions that appear red, swollen, or weeping, vomiting or diarrhea, chronic or constant cough, any general feeling of illness. Patient Bill of Rights. HOG Patient Bill of Rights. As a patient and community member of Harbor of Grace Enhanced Recovery Center, LL, patients have the right to 1. Humane treatment that affords reasonable protection from harm, exploitation, and coercion. 2. Be treated in a manner that respects the rights and responsibilities of patients, free from physical and verbal abuse. 3. Be informed about the individual treatment plan and to participate in the planning and implementation of the plan as well as any changes to the plan. 4. Confidentiality of patient records, as defined by CFR 42 and HIP-AA. 5. Be informed of the program's grievance procedures and the right to submit complaints without fear of discrimination or retaliation, and to have them investigated by HOG within a reasonable length of time. 6. Receive a written notice of the address and telephone number of the state licensing authority and the right to file a complaint with that authority. 7. Obtain a copy of HOG's most recent documentation of licensing inspection from the state licensing authority upon written request, and 8. An informal review and appeal of any involuntary discharge.